Okay, hello everyone. My name's Teddy Milgram, and I'm happy to welcome you to the 8th annual Cannabis in Practice webinar series hosted by Washtenaw County Health Department. This series is aimed at addressing questions our local and regional healthcare providers have about cannabis use and their patients. Our speakers come from a wide range of backgrounds and are experts in their respective fields. Funding for this series comes from the Michigan Department of Licensing and Regulatory Affairs Cannabis Regulatory Agency. This live webinar has been approved for 1 general social work credit, 1 MCBAP specific credit, 1 Mishwa CHW credit, and 1 CHES credit. If you are requesting any of these continuing education credits, you are required to attend the full session. Attendance will be verified through Zoom Analytics. If you are not requesting CEs, you can choose to receive a certificate of general attendance. A completed post-webinar evaluation is required to receive CE credits or a certificate of general attendance. A link to the evaluation will be shared at the end of the session. Please note that the evaluation survey must be filled out within 7 days of the session for which you are attending and requesting credit. Certificates will be sent out via email within 30 days. Once you receive the email, you will have 30 days to download the certificate. To review some housekeeping notes, all participants will be muted throughout the session. If you require a live transcription, select the Show Captions function. If you do not see it, resize your window to be wider. Please ask all questions for our speaker through the Q&A function, which can be found at the bottom of your screen. We will have time at the end of the webinar for the speaker to answer questions. This webinar is being recorded. The webinar recording and presentation slides will be available on our website, washtenaw.org/marijuana in the coming weeks. None of the planners or speakers for this educational event have any relevant financial relationships with ineligible companies to disclose. And with that, I'm pleased to introduce today's speaker, Cori Hammond. Cori is the Senior Director of Prevention Services at Partnership to End Addiction in New York City. She currently works with partners in New York, New Jersey, Arizona, Iowa, Oregon, and elsewhere to bring evidence-based services and resources to public school students, caregivers, and school faculty. Cori received her Bachelor of Science in Public Health degree from Tulane University and her Master of Public Health from New York University. So, welcome, Cori, and I'll turn it over to you to begin your presentation.
Great. Thanks so much, Teddy, and thanks for having me this afternoon. Let me make sure that my screen sharing is all set up. Okay, I think that should be right. Um, so again, thanks so much for having me this afternoon. My name's Cori, and I am from Partnership to End Addiction. And today I'm going to be talking about bringing a mental health lens to youth cannabis use prevention. If you haven't heard of Partnership to End Addiction before, that's okay. We are a national nonprofit headquartered in New York, so I'm coming to you from Brooklyn. And our mission is to transform how our nation addresses addiction by empowering families and all of the adults who are surrounding young people. here are our main priorities as an organization. The first is to keep youth substance free for as long as possible. This is the main pillar in which I work. I'm our Senior Director of Prevention Services. We also have a pillar in which we're trying to increase access to effective treatment for young people. And the third pillar is empowering families as agents of change. And so essentially, we serve the helpers, parents and caregivers, professionals, and other adult supports in young people's lives. We also have direct to family services. I'll go through some of our resources at the very end. But today I'm mostly going to be talking about pillars 1 and 2. So preventing substance use, cannabis use in the first place, but also ensuring that those who are using are getting the help that they need. In this field, we often consider mental health and substance use as separate issues, and we treat them in separate silos. Cannabis, in particular, is a great example of why that's not the best approach. Youth mental health needs to be considered for both effective prevention and effective intervention. So let's get into it. The first side of this coin is adolescent substance use. And the kind of main thesis to this section is that our research-based prevention is working. A great example of this is the decline in cigarette use among all people, but especially adolescents. You can see this is monitoring the future data going back to the early 90s, where over 50% of 8th, 10th, and 12th graders had used cigarettes before, whereas as of 2024, we're down to less than 10% in having ever touched a cigarette. And so, we did this by making smoking illegal indoors, increasing the legal age to 21, taxing cigarettes heavily. And so cigarettes became harder to get, more expensive, and just less cool. So a great public health story. So then, of course, the cigarette industry innovated and we got vaping, but we've had, slightly less, but still progress when it comes to vaping. This is CDC data over the last couple of years. We can see that for both middle and high schoolers, nicotine vaping peaked in 2019, just before COVID-19 pandemic, and then has slowly and with some blips decreased since then. Um, but for all substances, this is again monitoring the future data, past year substance use among 8th, 10th, and 12th graders. We're looking at the most common substances among young people. So alcohol, nicotine vaping, and then marijuana use in the last two clusters on the right. So you can see that alcohol is the most common, and naturally, past year use increases as age increases. These are the substances that are most widely available and backed by very powerful industries that are promoting their use. But an important takeaway from this is that while these numbers are definitely high, none of them are above 50%. So the majority of high schoolers, thankfully, are not using substances and have not used any substances in the past year. Not totally the focus of this talk, but a similar story with drinking. Despite a slight increase after 2019, youth drinking has been pretty much on a steady decline for the past 4 decades. Alcohol use among 8th and 10th graders in 2025 is at an all-time low. Among high school seniors, over half have never used alcohol, and almost 80% are not current users, so have not used in the past month. And so that's a really great, idea that we really want to normalize. This idea that not using substances is the norm among adolescents. This graph here is again monitoring the future data, looking at no use of substances in the past month, and the purple line is lifetime non-use. The proportion of young people who have never used any substance increases year after year. The majority of young people are not using substances. As of 2025, 73% of 8th graders, 61% of 10th graders, and 41% of high school seniors were lifetime abstainers. So they've never used tobacco, they've never used alcohol, they've never used cannabis. And this upward trend is really important for us to keep in mind, especially as we're talking about cannabis and vaping. It reflects important changes that we've made in the way that we approach prevention. We're much more focused on health and safety rather than punishment. Um, and so if we normalize this non-use, that's very important. As much as we can, we want to frame things in this positive, strength-based way. We want to make the healthy behaviors that most young people are engaging in the norm. Want to fit in, most young people your age are not using substances. But as we know, even though more young people are abstaining from substance use, there is heightened risk for those who are most vulnerable today. The substance use landscape is more dangerous than it used to be. Part of that has to do with child-directed marketing for vaping devices. Vaping products are being marketed to younger and younger audiences. I'm sure most of us can recognize that a Toys R Us themed vape shop is maybe not the best marketing if you're only looking for adult customers. Packaging for cannabis edibles, things that are made to resemble snacks and candy, posing harm to young children who might not be able to read the fine print and know what these are and distinguish them from the snacks that they know, but also reducing the perception of harm among older kids. So associating cannabis products with benign candy and beloved snacks makes young people perceive cannabis as less harmful and more normalized. And we also know that marijuana cannabis products are becoming increasingly more potent. This is DEA data from the mid 90s until 2022, showing that while the percentage of CBD, so the non-psychoactive component of the marijuana plant, has stayed basically the same over that time. The percentage of THC in marijuana flower has greatly increased, almost quadrupling in the past 25 years. So now about 35% THC is common in smoked marijuana relative to the 3 to 5% in the 80s and 90s, upwards of 90% THC in oils and edibles. And so, you know, these are extremely high doses of THC in these products. And the reason that we're concerned about that is that a higher THC potency leads to higher risk for young people. Adolescents' brains are still undergoing construction, and when you introduce very high THC potent products to that developing brain, the risks and the negative outcomes are much more substantial compared to the fully developed adult brain. And so these higher THC products, we see increased cannabis use disorder among young people. We see increased mental health negative outcomes, increased depression symptoms, anxiety symptoms, sleep issues, memory loss, academic challenges. The big finding in the last couple of years is the link with onset of psychosis, especially among those who are already vulnerable with a predisposition to psychosis, and increased suicidal behavior. There's also physical effects. We've seen the increase in CHS, so that cannabinoid hyperemesis syndrome, the consistent vomiting. We see car crashes. More people are pulled over and assigned DUIs today for cannabis compared to alcohol, which is a big shift. We're seeing an increase in childhood poisonings and ER visits. So basically, every negative outcome that we're concerned about when it comes to cannabis is exacerbated with these much more potent products. And we know that these substances have effects on the developing brain. We know from brain imaging studies that show structural and functional changes, including in areas associated with mental health, so things like reward, emotion, and motivation. In general, teens are less sensitive than adults to the normal signals to stop or reduce use. A good example of this with alcohol is teens are much less likely to get a hangover the next morning compared to adults, so that negative feedback loop doesn't always work with teens. And these high doses and high potency of substances can cause serious mental health symptoms, including anxiety, depression, and psychosis, as I already mentioned. And these negative consequences are not always very, like, so far in the future. A lot of them can happen quickly after starting to use. So for those who are predisposed to psychosis or have a family history of mental health disorders, we know that high potency marijuana can be the switch that triggers that first psychotic episode, unfortunately. We also know that chronic heavy marijuana use leads to an elevated risk of suicide and suicidal behavior. So that's a good segue into the youth mental health side of this coin. I'm sure it comes as no surprise to those of you on this call that youth are struggling with their mental health today. This is CDC data from the YRBS survey from 2023. Um, and this is high school students. So about 40% of high school students say that they've experienced persistent feelings of sadness or hopelessness in the past 30 days. 20% have seriously considered attempting suicide, and just less than 10% have attempted suicide. And again, it's important to note that this is averages among all students. We know that there are specific groups being at higher risk. LGBTQ plus students are at a higher risk for these serious mental health challenges, among others. This is kind of a smattering of different data, but we know that young people are experiencing specific negative emotions. 1 in 6 say that they're reporting specific negative emotions all the time or often. 1 in 4 have been diagnosed with a mental health condition. An estimated almost half of adolescents aged 13 to 18 in the US have some sort of mental health challenge, with 22% reporting severe impairment or distress. And we know that 50% of mental health problems surface by age 14, with 3/4 surfacing by age 24. Um, and so this period of intense brain development in adolescence leads to heightened vulnerability to a whole host of mental health challenges. We also know that chronic stress will impact mental health and the developing brain. Chronic stress can harm the brain, leading to difficulties solving problems, increased impulsivity, difficulties managing emotions, reduced attention and motivation, challenges with learning and memory, anxiety, difficulty making choices, higher likelihood of taking risks, including substance use. So young people are dealing with a lot. And so I want to put these two together, the substance use part and the mental health part, and talk about this idea of co-occurring disorders. So a co-occurring substance use and mental health disorder. One of the clearest relationships between mental health and substance use is the relationship between adverse childhood experiences and the risk for substance use. So these ACEs are things like abuse or neglect, having domestic violence in the home, having mental illness or substance use in the home. There's a whole list of these adverse childhood experiences. And the more of those adverse experiences a young person has had in their life, the higher their risk for substance use, but also a whole host of other negative outcomes. So here we can see the different colored bars are the number of ACEs that a young person has experienced, and these are adjusted odds ratios of different types of substance use. So smoking, alcohol use disorder, having ever used illicit drugs, and having ever injected drugs. Um, so as you can see here, there's almost a linear relationship. ACEs are associated with increased risk for multiple types of substance use and substance use disorders, and it's a dose-response relationship. The more of these someone has, the higher their risk is. There's other research that shows a link between ACEs and earlier age of starting to use substances. There's very good research that shows relationships between ACEs and suicidality. Basically, every negative consequence that we're concerned about for young people, there's a relationship to having these adverse childhood experiences. A little bit more. This is data about nicotine vaping specifically, but I'm sure a similar story for marijuana vaping. The more ACEs a young person has experienced, the harder it is for them to quit vaping. Nearly 90% of adolescents who vape report at least one adverse childhood experience. Teens with four or more ACEs are 20% less likely to successfully quit vaping. ACEs are tied to certainly nicotine addiction, but also greater emotional distress and lower confidence in quitting. And the kind of causal mechanism here that they theorize is that vaping may be the coping mechanism that young people are reaching for their to cope with their trauma. So that makes quitting more challenging. So when it comes to co-occurring disorders, we're thinking about substance use disorders and mental health disorders. Here are the characteristics of a substance use disorder. These are the 11 clinical diagnostic criteria. 2 to 3 symptoms would be a mild substance use disorder, 4 to 5 moderate, 6 or more severe. When it comes to substance use disorder among adolescents, among youth age 12 to 17, just under 8% met clinical diagnostic criteria for a substance use disorder, and unfortunately, only 30% of those who needed treatment received it. So we know there's a treatment gap. And so this idea of co-occurring disorders is the presence of both one or more mental health disorders and substance use disorders. So you need to reach clinical criteria for both. Here are some of the mental health disorders that are commonly co-occurring with substance use disorders. So certainly things like depression and anxiety, but also attention deficit hyperactivity disorder, ADHD. Eating disorders often go hand in hand with substance use disorders, PTSD, bipolar, and schizophrenia. Some data to support this. We know that substance use is higher among teens with depression. This is comparing teens who have had a major depressive episode in the past year compared to the yellow bar, teens who have not had a major depressive episode in the past year. And so, as you can see, all of these different types of substance use, so illicit drug use, marijuana, opioid misuse, binge drinking, tobacco and or nicotine vaping, much higher among the teens who have had a major depressive episode compared to those who have not had a major depressive episode. Just in general, teens with depression have 3 times higher rates of substance use disorders, almost 19% of teens with depression versus 6% of teens without depression. And we know that treatment is difficult to come by for this population. Only 11% of young adults who had a co-occurring disorder received treatment for both their substance use and their mental health disorder. This is less than any other age group. As you can see here, the purple, about 45% received mental health care or substance use care, but not both. 44% received no treatment whatsoever, and only 11% received that kind of integrated care of both. And this is important because compared to people with just a mental health issue or just a substance use issue, people who have the co-occurring disorder, both at the same time, have more profound functional impairment, higher risk for dropping out of school. It's more expensive to treat them. Their treatment outcomes are worse. They're at a higher risk for homelessness, incarceration, sickness and death, including suicidal behavior. Um, so compared to just one mental health disorder or just a substance use disorder, the combination of both makes treatment more difficult and more likely to be unsuccessful, unfortunately. So let's talk about the risk and protective factors involved with this. First, the pathways to developing a co-occurring disorder. We usually talk about it in these 3 kind of pathways. The first and the most common is that someone has an existing or an emerging mental health issue or mental health challenges and turns to substances to self-medicate. They're trying to make themselves feel better, and so they're reaching for substances as a way to escape from those negative feelings, which then leads to dealing with still the mental health challenge, but then also substance use challenges on top of that. The second is that someone has a change in mental health status induced by substance use. And so this could be, a kind of the tried and true example that we hear of among youth is you have a young person who experiences a sports-related injury that are then prescribed opioids after um, ACL surgery or something of the like, and then they're the substance use comes first, but there's all of these other factors that are leading to a change in the mental health status that they've been taken away from their protective factor of their team. They're now using substances, and then it kind of spirals from there. And then the third is that someone has a predisposition to both mental health and substance use disorders. They both kind of come about at the same time and then start to influence each other, but we can't really pinpoint which came first. And so the main idea here, and the most important idea, is that substance use and mental health have a bi-directional relationship. A young person might attempt to self-medicate with cannabis for temporary relief from negative emotions or to ease untreated symptoms of a mental health disorder. And so what we know is about 1 in 2 people with a substance use issue also face a mental health challenge, and it goes the other way as well. About 1 in 2 people with a mental health challenge also face a substance use issue. So if a young person is struggling with their mental health and is self-medicating with cannabis or any other addictive substance, they can very quickly start to rely on that substance to alleviate those symptoms and spiral into addiction. But then vice versa. Using a substance like alcohol or cannabis can trigger or exacerbate a mental health condition. So we know that if you're treating a child who has a mental health disorder, they're going to be at higher risk to use and misuse substances. But then again, on the other hand, if you have a young person who is using substances, they're more likely than others to develop a mental health disorder. And so for kids who are very anxious or very self-conscious, substances provide an opportunity to escape from those feelings for a time. It's a risky, dangerous escape that can make all of those feelings worse in the long run, but that's not so obvious in the short term. And so being aware of these feelings in the young people that we are working with can help us to point them into safer and healthier alternatives. So specifically some risk factors for co-occurring disorders. We know that genetics certainly plays a part. Just genetic inherent differences in brain structure and personality and how someone's brain functions. Family history of either mental health or substance use disorders is going to put someone at higher risk. Stressful events, including abuse, trauma, bullying, again, those adverse childhood experiences, having a strained parent-child relationship, disruptive life changes, a feeling of disconnection at school, feeling unsafe at home or at school, um, lacking in coping skills and resilience. Again, for that one pathway where the substance use comes first, an injury, illness, or pain that is not being adequately treated, and then certainly substance use will put someone at risk for a co-occurring disorder. Protective factors for co-occurring disorder. Most of these are the opposite of the ones on the other slides, but having good problem skills and coping skills, having substance-free social activities, a sense of connectedness at school and at home, spirituality, routines, goals, having a sense of purpose and mattering to those around you, having a good parent-child relationship. And I put this one in bold at the bottom because we know it's one of the strongest protective factors for young people is a bond with a trusted adult. Sometimes it's a parent, but it's not always a parent. It can be a sibling, an aunt or an uncle, a teacher, a coach, just any trusted adult that this young person knows cares about them and cares what happens to them is a very strong protective factor. So in public health, we're often thinking about kind of this seesaw or this fulcrum. For an individual, we're trying to reduce the weight of risk factors on one side and really bolster the weight of protective factors on the other side. We know that we can't erase somebody's adverse childhood experiences. We can't erase someone's family history of addiction, but we can strengthen protective factors that we have control over. So we can try to tilt the scale back into someone's favor by giving them coping skills, engaging after school activities, making sure that they have a trusted adult. We have control over all of those things, and so we can really bolster some of these protective factors. So, a little bit about prevention and how to intervene. The first and kind of most basic idea here is to understand the why. Kids' behavior, though often baffling, it does make sense. Behaviors happen for a reason, and so we really want to uncover the why. Young people use substances for many different reasons: social pressure, curiosity, to cope with stress, anxiety, or depression. So, understanding that why is so important. Ask why they're using cannabis or why they might be considering it. And so then we can discuss healthier ways of meeting those needs. There are many very valid reasons why young people might be tempted to use cannabis. Many young people, as we said, are struggling with their mental health, and cannabis can provide short-term relief for them. And so if we understand that why, then we can get them the support that they need and find healthier alternatives. We also want to challenge perceptions of what is normal. Many young people and their parents overestimate the number of people who use substances, which normalizes it, reduces how harmful it seems, and increases the risk for use. So, again, in reality, the majority of young people are not using cannabis, they're not vaping marijuana, they're not vaping tobacco, and so we want to make that the norm because it's true. And in terms of prevention, it's really important to try to leverage what's important to a specific young person. If they are someone who is academically motivated, we want to let them know the importance of avoiding use of cannabis for as long as possible to allow for healthy brain development. We can tell them how it's going to affect their memory and their learning and their attention. If athletics are really important to them, we can explain how smoking or vaping cannabis is going to interfere with their respiratory and cardiac health. It's going to decrease their stamina. It's going to make their performance worse. If there's someone who's concerned about their mental health and is really careful about their wellness, we want to talk about how cannabis is going to increase their stress, anxiety, depression symptoms, and those much more serious mental health conditions risk, like psychosis. If they're a young person who doesn't want to be, part of this corporate mentality that's supposed to say anti-corporate mentality, so we can explain the role of these industries and big business, including celebrity endorsements, in compromising youth health for profit. Maybe it's a young person who's very environmentally conscious. We want to talk about the environmental damage of vapes littering landfills. Maybe there's someone who cares about their financial independence and wellness, so we can highlight the high costs of cannabis over time. And maybe they're just someone who wants to be independent. And so we can tell them how being addicted to cannabis is going to interfere with their independence and is very much a form of conformity. When we get to the secondary or tertiary prevention, we think about this window of opportunity. The time between the onset of the mental health disorder or the mental health symptoms and the subsequent substance use disorder is that window of opportunity to prevent a co-occurring disorder. Almost 90% of people who have a co-occurring disorder had the mental health disorder first, before the substance use. Generally, we see that the mental health disorder occurred in early adolescence, median age of about 11, followed by substance use disorder about 5 to 10 years later. So, median age of about 21 for when the substance use disorder comes together. Because then at that point, if you're 21 years old with both a mental health disorder and a substance use disorder, getting adequate help is so much more difficult than if we had intervened when it was just the mental health that we were dealing with. And so we know that studies have suggested that unidentified or untreated mental health disorders can lead to difficulty engaging in treatment for substance use, difficulty of completing treatment, and a difficulty making progress in treatment. And so this is really important that we try to kind of nip that in the bud before it becomes the full-blown co-occurring disorder that's much more difficult. A lot of what we do at Partnership to End Addiction is um, training and workshops and education for parents and caregivers. So when I talk to parents and caregivers about co-occurring disorders and trying to prevent them, a lot of what we say is make sure that you know what your young people are doing and be very curious about their lives. So we want to notice any significant or persistent changes in their moods or emotions, their behavior or their routine or their appearance. Maybe they're becoming more socially withdrawn. We want to be on top of that. We want to keep communication open, having frequent, honest, open conversations. These conversations can be very awkward for many parents. And so the more frequent they are, the more casual they are, the easier it's going to be both for someone as a parent and for the teenager that they're talking to. Again, as much as we can, we want to support healthy alternatives. So encouraging pro-social, substance-free activities. If kids have things that they really care about and they're very passionate about that aren't substances, they're going to be less likely to reach for substances. So we want to build routines that support healthy habits like sleep, exercise, and social connection. We want to teach parents to model healthy behaviors, including help seeking. So we want to show young people that asking for help is not a weakness, but a strength. And we want to model healthy coping and stress management for ourselves. And an important one is to try to coordinate care as much as possible. So for parents, we say to discuss this with all of the healthcare providers in a young person's life. So this means if a young person, we know that they're struggling with depression or anxiety symptoms, and they're about to be prescribed opioids after getting their tonsils out, for instance, that's something that we want all of those healthcare providers to be aware of because they're at increased risk. If addiction runs in the family, that's something that teens need to be aware of. In cases of sports injuries or other high-risk situations, it's important that teens understand what may make prescription painkillers or other substances more risky for them versus some of their peers. If things like psychosis or bipolar disorder or schizophrenia run in the family, we need teens to know that marijuana is going to be more risky for them than maybe for some of their peers. We just want everyone to be informed and on the same page to avoid adding unnecessary risks in any situation. So things that we tell parents not to do. We don't want to ignore or minimize changes. Some parents will often say, they're acting strange, but it's probably just a phase. All teenagers are strange. We don't want to dismiss significant or persistent changes. We don't want to think that it's just something that they'll outgrow. We don't want to react with anger or panic. Strong emotional reactions can shut down communication and make it harder for young people to seek help or to ask for help. We don't want to rely on punishment or ultimatums. We want to have a health-based approach whenever possible that really focuses on health and safety. We know that just punitive approaches will increase secrecy rather than improve behavior. For young people who are struggling with their mental health or struggling with substance use, you're not going to be able to punish them out of that. They need support. And we tell parents to not handle it alone. This is not something that you have to handle entirely by yourself. Managing concerns without adequate support can really delay effective help and can prolong difficulties. We often are telling people what to look for if they've decided that they want to seek treatment for mental health or substance use. Again, early intervention is key. We want to coordinate mental health and substance use help in an integrated treatment plan whenever possible. We know that this is not always easy to do. There's a lot of barriers that exist for integrated co-occurring disorders care. Um, but as much as we can, if we can get both sorted out at the same time, we're going to be much more effective. So, positive and supportive social interactions for young people are so important if they're in treatment. We want to have healthy recreational activities. We know that family involvement is so important in youth treatment. We know that young people have better treatment outcomes when their families are involved. And this idea of no wrong door to enter treatment. So, we want young people to get the help that they need, no matter how they access care. If they come in for a mental health problem, but it's discovered that they're also using substances, we can address both of those. If they come in for substance use, but are also struggling with their mental health, they can get help for both. Unfortunately, our treatment system today is often fairly siloed. A lot of people who go in for mental health care are discharged or not able to be treated if they're also using substances. It's a difficult system to navigate. And so wherever possible, we want to have this no wrong door that people can get the help they need, a whole person approach. And so now I want to share some of our information and resources and support at Partnership to End Addiction. We have a whole prevention side of our website. A lot of this is targeted towards caregivers and families, but also for professionals. Articles on what is normal and brain development. We have tools that families can use to try to get a risk assessment of their situation when it comes to their young person's substance use, playbooks for parents of tweens and teens if they're looking for conversation starters, a way to continue to have those open conversations about substance use. We have a ton of free resources on our website, drugfree.org. All of these are available in English and Spanish for free. We have a full marijuana resource center. So the QR code here should take you to that page, but again, pretty easy to find on drugfree.org. We also have one totally in Spanish. Basically, anything that anyone would want to know about cannabis, we have an article for it under this resource center. We also have a co-occurring disorders resource center. So again, articles about what it is, but for those who are seeking treatment, some help there, articles about how to prevent it. And we link to things like the SAMHSA Tip 42 that is all about treating those with co-occurring disorders. Just a lot of very helpful resources here. For families who are having difficulties paying for treatment, we know that that is often a roadblock and a barrier. And though we have the Parity Act and the Parity Law, it's not always enforced, and young people are still finding it difficult to access the care that they need. So we have articles and help for families who are trying to navigate the treatment system. Um, and similar in that same vein, we do have individualized support. So we have a helpline where you can immediately get in touch with one of our helpline specialists over phone, email, text. If you want help navigating the treatment system, they will help you to find treatment in your area that takes your insurance, or if you're not insured. We also have online support groups led by our parent coaches. We have a grief support group for those who have lost children for substance use. We also have personalized text messaging programs, self-paced trainings for parents as well as professionals, all available on drugfree.org. So please feel free to use these tools for your own use, but also recommend them and share them to your patients and the families that you work with. All right, so I know I went through that pretty fast, but thank you so much for sticking with me. Here is my email here. Please feel free to email me. and reach out. And again, drugfree.org for a lot more information and resources. But thank you so much for tuning in this afternoon. And now I have time for questions.
Thank you for that wonderful presentation, Cori. So we are going to open it up for questions. Again, we do ask that all questions be submitted through the Q&A function, which can be found at the bottom of your screen. You can also give a thumbs up to someone else's question if they've already asked a question that you're also wondering the same question. That can maybe help us a little bit to prioritize if we don't have time for all of the questions. So to start, our first question is, what guidance do you have for parents who consume cannabis intentionally or responsibly? How should they talk to their kids about it in a way that supports youth prevention rather than undermines it?
Yeah, we get this question a lot, and it's a really great question. I mean, the biggest one is to make sure that your can or adult cannabis products are out of sight, out of mind, locked up. We, with the legalization and normalization of recreational marijuana, have seen, unfortunately, so many childhood poisoning um, events. And so we want to make sure that products are inaccessible to young people in the home. But in terms of how to talk to young people about it, a really great way is to go the brain science route. We know that cannabis affects the adolescent developing brain differently than it affects the adult brain. And we know that using substances at an earlier age puts someone at higher risk for addiction later in life. A stat that we share all the time is that for young people who use substances for the first time at age 18 or younger, there's a 1 in 4 chance that they will go on to develop addiction later in life, whereas those who wait until 21 or older to start, that risk drops to 1 in 25. And that really comes down to adolescent brain development. And so parents who use cannabis products, we don't want to lie to kids and we don't want to um, be untruthful and break their trust, but you can talk to them very explicitly about how this is a harmful thing for adolescents to use. This is something that adults can use responsibly for a variety of reasons. Um, but it's dangerous to the developing brain. Um, and, we are not advocates for scare tactics or trying to, scare the hell out of kids so that they don't do things that we don't want them to. But the data around youth cannabis use and early cannabis use, especially high potency products, and the risk for the development of psychosis and some of these much more serious mental health conditions is very striking. And there's a way that we can teach teens about that that is evidence-based and rooted in evidence and not a scare tactic. And so I think it's important for teens to earnestly learn about those different aspects, about the developing brain, how it's harmful while their brain is still developing. But many adults obviously use cannabis recreationally with slim to no negative outcomes. So we can be very honest with teens about this. But it is, it's a difficult conversation to navigate, and there is a right and wrong way to go about it, I think.
As a follow-up to that or relatedly, do we have data on what role it plays if a parent or trusted mentor uses marijuana, how that could affect the likelihood that the youth will also start using marijuana and other substances?
Yeah, so there is good data that shows that young people who grow up seeing substance use in the home are going to be more likely to think that that substance is not as harmful, to perceive less risk from using it daily, and to engage in their own use. We've had data about this for decades when it comes to cigarette smoking and nicotine use. We know that young people who see their parents smoking are more likely to smoke. And so we know that if the trusted adult in a young person's life engages in substance use, in marijuana use, the perception of harm in that young person is going to be decreased, which is kind of a direct proxy for increased risk of use as they get older. Similar story with alcohol. You know, if you have family members who drink in the home, we know that it decreases the perception of risk for young people, more likely to use in the future. So to that end, you know, we would advocate for parents if they are going to use cannabis products to not do it where young people see. Um, Again, we don't want to lie about it, but just seeing the trusted adult engage in substance use frequently is going to lead to that reduced perception of harm, which we know leads to increased chance of using as they get older.
Thank you. Another question is, what kinds of replacement behaviors have worked in your experience?
Yeah, I mean, it comes down to what the child is interested in, especially for teens that are, how to put this nicely, driven towards risky behaviors. We want to be cognizant of that and push them towards safe risks. So for a lot of kids, it ends up being sports or skateboarding or other athletic activities. If they are creatively minded, we want to put them into drama competitions, poetry competitions, songwriting competitions, something that's going to scratch that itch of sensational, exciting challenges and experiences. You know, if we just tell kids to, you know, we want to be aware of what really gets them going and then push them towards that as long as it's a healthy and safe alternative. For kids who are, we see often kids who are very anxious, who are driven towards cannabis and other substances to get rid of that kind of anxious feeling. We can do CBT. We can train them and try to increase their coping skills. We can try to put them in situations where they feel anxious, but then succeed and build up that confidence and that resilience. So really understanding what the young person is going through and what they're drawn to, and finding ways to satisfy those feelings in a way that is beneficial.
Great. Looks like maybe we have time for one or two more questions. So do we have data on cannabis use in colleges, and what is the association it has with mental health in that population?
Yeah, that's a great question. I haven't looked at college data in a while. I spoke at a college um, conference a few years ago. We do have our whatever the national survey is that some colleges do, the college youth student health survey. So we do have cannabis data for college students. It's definitely higher than the 12th grade data that we see from Monitoring the Future, but it's still lower than most people assume. So cannabis is, you know, prolific on college campuses, but still over time, less college students are using cannabis than in decades prior, which is great news. But again, the high potency products are still an issue on college campuses. Um, and as they mentioned in the question, the mental health aspect really kind of rears its head in college, especially for the more serious outcomes. For young people who are going to have that first instance of a psychotic episode or a manic episode in bipolar, very often that happens in the college years. So we're going to have a lot more interesting and hopefully useful data in the years to come showing kind of that relationship between high potency THC use and serious mental health consequences in college. But it's definitely a problem, and colleges are to mixed degrees of success trying to get ahead of it.
All right, and one last question that we'll have time for is, are there more resources for a harm reduction approach to substance use prevention?
Yes, definitely. Especially in kind of the opioid world, a ton of harm reduction resources. On our website, we have a whole reduction resource center. In terms of harm reduction for marijuana, I know of there's an app that has very interesting data. I think it's called Clear 30. I could look it up and find it, but it basically got its start with Dry January for alcohol, but encouraging people who are having issues with their cannabis use. It's a very motivational app to help people through um, reducing and moderating their cannabis use. And there's been a couple RCTs with it that are very promising and seems to be a very useful way of harm reduction for cannabis. In terms of harm reduction, just in general with substance use, there's a ton of great resources out there. I think about, naloxone distribution as a great one, but mostly just trying to educate and make people aware of harm reduction tendencies as not the enemy, but very much a necessary component of adequate addiction care.
Thank you so much. And yes, I will confirm that Clear 30 is the name of the app that you were mentioning if people want to look into that more. So it looks like, unfortunately, that's all the time we have for questions today. But if we are unable to get to your question, again, Cori's provided her email address, and we also will have it on the slides that we share. And so you can always reach out to her directly to follow up with any of your questions.